In today's lesson, we will be discovering the different types of diabetes. Last week's video introduced this condition and we looked at what happens inside your body when you have diabetes. If you want to refresh your memory or you haven't watched it yet, there is a link to the previous video in the description box. Here is the mother and son duo we were introduced to before. She's 40 and he's 10 years old. They both have diabetes, but the way the disease came about is different for each of them. Firstly, let's take a look at the boy. He's been suffering from all the classical symptoms of diabetes despite being a young, active and happy kid. The usual culprits of disease such as a bad diet and bad habits can't be blamed here. In a 10-year-old child, they wouldn't have had enough time to cause damage to his body. His type of diabetes is known as type 1. In type 1, the body's own defense system, which is affectionately known as the immune system, decides to declare war on a vital organ called the pancreas. Within the pancreas, there are many cells which do many different jobs. The immune system decides to destroy one group of cells known as beta cells. These are responsible for producing insulin, the hormone which keeps blood sugar levels in check. Without insulin, the accumulating glucose in your bloodstream begins to cause damage to your organs, and you start to experience those symptoms we mentioned earlier. Conditions where your own immune system launches an attack on your own body are known as autoimmune diseases, and that's what this boy has. Because of the destruction of those valuable beta cells, he is unable to produce insulin on his own, and his treatment will need to cover for the loss. He can give himself insulin by injecting it into the fat layer beneath his skin. It's not as horrible as it sounds, as the needles used are incredibly small and fine, making them virtually painless. But if it bothers him too much, he could always ask his doctor for the insulin pump, which is a machine connected to a small plastic tube placed into the fat layer that can deliver the necessary insulin with just a push of a button. Whichever method you use, the treatment is ultimately the same. In type 1 diabetes, you need to get insulin into your body, which will make you feel tons better. Okay, so we've treated the boy. He's happy to get on with his life, and now we need to take a look at his mother's health. She has type 2 diabetes. This tends to affect older people, with diet and lifestyle choices playing a much bigger part in causing this disease. Some risk factors include being overweight, having an unhealthy diet consisting of lots of treats, not getting enough exercise, and having close family members who already have the condition. Although the mother's symptoms are the same as her son's, the mechanism in which her type 2 diabetes has come about is quite different. The beta cells in the pancreas responsible for producing insulin grow tired over time and produce less and less of the necessary hormone. Along with this process, the cells around the body which utilize the glucose by converting it to energy become resistant to the power of insulin. So a combination of low insulin production and increased insulin resistance leads to the high blood sugar levels seen in diabetes. The treatment of type 2 diabetes offers more options than type 1. Similar lifestyle changes must be made in both conditions. A healthy diet full of vegetables and less sweet treats is a good start, and in type 2 diabetes, these changes may be enough to control the levels of glucose in the blood. But as time goes by, the disease can progress, and medications in the form of tablets and pills can help the body to produce more insulin or become more sensitive to its action. Eventually, the disease may need injectable insulin to keep it in check, where the modes of delivery are the same for type 1 diabetes. Now we have covered the two main types of diabetes and their treatments. If you want to know more about this condition, or you have a cool suggestion for future videos, leave a comment below or email us directly. Don't forget to subscribe so you'll never miss one of the exciting weekly lessons. See you soon!